Good evening, guys. Welcome to the live broadcasting of Erufu, the online community medical support network. I'm Shireen. People have been plucking, waxing, treating unwanted hair for decades. But when laser hair removal technology came to be in the mid-1990s, it changed the way that we go. Over the past 20 years, laser hair removal has become the go-to method for stopping unwanted hair growth. And even though it's been around for quite some time, people still have lots of questions about it. How well do you really know about laser hair removal? Tonight, we have invited a medical aesthetic physician, Dr. Chia, the healthcare partner of Erufu Care, to share with you guys about laser hair removal. Welcome, Dr. Steve.
Hello.
Hi, good evening, Dr. Steve.
Hi. Hey, guys. Thank you for inviting me today to share about one of the most commonly done treatment in our center, which is the hair removal laser. So we've been performing this treatment for the last 5 years, and we've been seeing a large group number of patients coming in, and they have a lot of questions because a lot of people actually don't really know in detail how laser hair removal can help them achieve the kind of easier grooming and lifestyle, and then help them achieve smoother skin. So I'm glad that today we're going to talk in detail about this topic.
You may start the sharing.
Okay, so I'll start my slides. Let me just share. Okay, I'm going to put full screen. Can you see it?
Yep, you press slideshow.
Okay. It's okay now?
Yeah, okay.
So I'm Dr. Steve Chia, and I'm the medical director of Sleep Clinic PJ and Sleep Clinic KL. So let me go to the next slide. So laser hair removal is actually done using laser system. So laser system, there are many kinds in the market. So also there are many kinds of system which is not laser. We're going to talk about different options that you may want to explore when you want to have your hair permanently removed. So okay, this is my portfolio. So now we see a big group of patients that basically going to clinic. This is just a comic where the husband is going for hair transplant and the wife is going to have the hair removed. Okay, so what are the different type of basically treatment available at home and also in the clinic? So in the clinic, right, we are basically dealing with more of a laser system. So of course at home you can do your shaving. Waxing is not done at home, but in waxing center, epilator not really done right now because this is more painful. So today we're going to focus on how laser is far more superior as compared to the other treatment. Okay. So if you look at realself.com, you will notice that 94% of patients who undergo laser hair removal are happy about. This is a website where patients actually go on and then check and see whether it's a certain treatment is worth it, got good reviews. But of course, this is not specific to any kind of laser system. You might want to do your research more on that. But then overall, laser hair removal has very high satisfaction among our patients. So back in 1964, where laser system start to develop, so there are a lot of research and study goes into this. So one of the earlier laser was not specifically designed to remove hair, but they are done to remove tattoo. So what happened when they do tattoo on area where the patient also have body hair? They notice that the body hair starts to go away permanently. So then they realize that this can open up into an opportunity of a new set of laser system that can deal specifically with body hair removal. So the first FDA approved laser hair removal system was in 1996. So it took a long time until it is deemed that laser is safe enough and efficient enough to deliver body hair removal result to the patients. So it stimulated then, of course, up to now, many different uh, pharma company, laser company go into seeing what kind of laser. That is why until now we have so many type of this already more than 10 years. We have so many type of laser system in the market that deal specifically to remove body hair. Okay, so this is the hair follicle. So basically what we are interested when we are talking about hair removal, we are focusing on removing the lower segment of the hair, which involve where at the follicle, at the hair follicle level. Okay, so basically the hair roots or the matrix, the stem cell area of the hair. So to be effective, if we are just doing shaving, right, we are basically not even touching anything below. Okay, if you are doing waxing, you are pulling it out, but it will grow back again. So in order to be effective at removing, we have to target in the lower segment and kill away the blood supply and everything at the hair root level. So in the human body, we have two types of hair phenotype, which is basically phenotype means the appearance, different appearance. We have vellus hair and terminal hair. Terminal hair is long and thick hair, pigmented, and this one is a deep hair. So it is seen in example, eyelashes, eyebrow, or hormone-dependent area like scalp, beard, chest, axillary, and the private area. Vellus hair are the small baby hair that we seen all over the rest of the body, or even some of the patients on the face as well. So vellus hair covers actually the majority remainder part of the body, and they are short and not pigmented, and it doesn't extend very deep into the dermis. Okay, so this is the hair bulb that we are talking, that I talked about just now. Whenever we want to do a very effective hair removal procedure, we are targeting the hair bulb or the root of the hair. So this is basically a hair cycle. I'll come to this later, but basically it is to tell you that at different point of time, all the hair are in a different hair cycle. That is why sometimes when we're doing hair loss treatment, totally opposite of what we're saying today, hair loss treatment, so hair go into different growing phase. And then when we're doing hair removal, basically the most effective phase where we remove the hair is at the growing phase as well. So we have three phases in the hair growth. Okay, so in the three of the phases I said just now, basically in the active phase, which is called as an anagen, this is where the hair lengthening is happening. And this is a time where you will go into clinic and then you will get the hair removal done, and then you can see excellent result. But of course, each time that you visit the clinic, you don't know body is undergoing this, which part of the hair. So that is why it's normal for hair removal treatment to be done over a few months. It's not a one-off treatment. What other methods that we have? Basically, we have waxing, like plucking, threading, shaving, trimming. This is what a lot of us are used to. We don't like the hair, we pluck it out first, or we do threading. Of course, all these are, I will let you know, that is actually conventional method, less effective, and also more painful. So the good news about laser system that we remove hair right now, it is quite painless, quite amazing, because every time when we think about hair removal, we always think about the pain that associated with hair removal. Then we need to do it every single month, right? So what we don't really do right now is the chemical depilatory treatment or electrolysis treatment, because all these things actually are very conventional and it causes burn to the body. So about photothermal means the new device, these are the long term. So you can see mechanical are not long term. So whatever we do at home, we have to do it monthly, or sometimes even earlier than monthly. And for laser, basically we are giving more of a long-term reduction of the hair follicle. These are the different type of laser when you go into a hair removal center or a clinic, because there's a difference. Because when patients scout around which is the best for them, but I would say for my advice is, if you are a lighter skin group, then you are not so worried which laser that we do. But if you are a darker skin type, that I would say you might have to do more research on which laser system that is suitable more for your skin. But you can of course get a consultation and then you ask them, my skin type and then my hair type, is your laser safe for my type of skin? So they will give you an answer on that, okay? Because they are the more experienced when they deal with different type. In my own experience, I've tried dart laser, and dart laser is one of the least painful compared to other laser. And then there's also another famous one, which is long pulse ND 1064 laser. Of course, each laser system, there are so many brands. Like we're talking about different type of cars. Dart laser is a different type of engine. Long pulse NDX is a different type of engine. So even for different type of engine, there's different brand. You have the European people making a car. You have the laser from US. You have laser from South Korea. So all these will then that's why there's a different in pricing when you visit different center because of the different machine that they use. So there is good quality one and there are so quality one. So it's good for you to ask and engage and let them know that you would like to know what brand and then you want to do more research on the laser. This is for the safety, okay? So another big group of treatment that usually I always hear from my patient, they have PL, hair removal, a beauty center, hair removal center. So IPL is not laser, number one. They are basically, IPL is a broadband light. So it is comparatively to laser. IPL is not that safe for darker skin type because when you have a broadband light, you are not targeting specifically for one wavelength. This is actually very technical, I know. But you can just remember that actually IPL is a more conventional technology, it's older, it's available more than 20 years already in the market. But laser is something is newer. And in terms of safety, number one, there's a big difference. Second, there's a big difference in terms of the result as well. With the laser, you get better results. Okay, there are, of course, in medical treatment, every procedure has associated complication that you have to take care. So there are some patients that have pigmentation problem after certain hair removal. This one, basically with laser hair removal, rare, but of course some patients are they easily have scar or marks. In that case, you might want to avoid a certain laser if you're darker skin type. So I always also hear patients who go for repeated waxing. Waxing, they always tell me that after waxing, the armpit become darker. After waxing, the feet, they have larger pores and they have a lot of all those enlarged pore or darkened pore area. So all this is called as dyspigmentation. It can be hyperpigmented, which is darker, or it can be hypopigment, which is lighter color. It can happen. Of course, burn is something that all patients always ask. Do I get burned? Whether or not you will get burned. It is one of the risks. It's not common, but of course, if we are doing the laser is performed by, let's say, less experienced operator, or maybe the laser machine, it is not designed for darker skin type, you might get burned. A lot of time, the burn also can be very redness that happen over a few days, or a deeper burn that will leave a scar or a mark. So not all burn will be, that means very bad. Because some patients that I've seen before, almost every time they do hair removal, they are very worried they might have prolonged redness. That also actually we will classify as a burn. But burn there is first degree, second degree, and third degree, right? If first degree, usually redness for a few days, it will go away, okay? So the third one is paradoxical hypertrichosis, which means when you do hair removal, instead of getting less hair, you might get more hair. This is only happen in certain rare cases, but it's documented, okay? So acne eruption means when you have acne breakout and then you do hair removal over a certain area and then the acne start to spread, is possible. Hyperhidrosis means more sweating once you remove hair. It's also possible but not common. Urticaria rash means some patient will have like allergic reaction after that, can happen if your skin is dry type. Erythema is just redness and over the spot. This is usually very temporary. Ocular injury is when the laser is performed without wearing specs and then when they're doing very near the eyes, okay? So all these actually, most of the side effects mentioned here is not common or is totally avoidable. That's why I say over the years, laser technology has been so common. We are very good with the laser right now. So a lot of time, all these are just like textbook kind of complication, okay? So I've told just now a little bit about IPL. So IPL is basically multi-wavelength, which is a broadband. So it's not like laser. Laser only have a one single wavelength. That is why laser only target hair follicle. But IPL sometimes, in order to remove the hair, it also accidentally target the skin. So it may have higher risk of burn. Okay. So one thing to note, efficacy of IPL, efficacy means how effective it is. So we always measure treatment or how efficacy it is only 33%, which means laser has a much superior clearance in efficacy. If with laser, you can go from 80% or 90% in terms of a permanent reduction in the number of the hair follicle. So IPL commonly is continuously done without stop. That is why IPL usually is cheaper. But then again, you cannot stop doing, you might keep on going back to do, okay? So there are also newer combination of IPL with the RF technology that can also give you better result, okay? But I will still mention that laser still give the best results. Okay, recently I have this group of patients who tell me that they go up online, Shopee and Lazada, and then they see some hair removal devices that is very small, handheld, and use battery. Okay, so they asked me, is there any difference between this kind of thing that you can buy on the internet versus the professional laser machine, medical grade that we use in the clinic? Number one, if something is handheld, it's very small. So in terms of the voltage or the watt, it is going to be in smaller wattage, okay? This one plays a big role in terms of the results, because in order for us to target the hair to remove it effectively, we need to hit a certain heat or temperature or a certain voltage. It's like, how do I make this comparison? It's like, maybe you think about it, professional kitchen cooking that people use in the chef in the restaurant versus the simple thing that we use at home. It's going to be much different. Like even bakery, right? The professional use bakery system in the baker and then the one that we have at the home. So there's a big difference in terms of the result, okay? So with this home use hair device, basically the result is very temporary. It will slow down the hair growth, but it will not permanently reduce the number of hair follicle, okay? So the safety issue also, if you're using at home, are you using a protection, you know, that kind of thing? If you flash it into a light, what will happen? And it unlikely give you a long-term hair removal effect, okay? Okay, this is the picture of the armpit when it's done using hair removal system. You can see laser actually give a very good results, even 3 sessions, 4 sessions, 5 sessions. Usually hair removal will need a minimum of a 6 sessions. Some patients maybe more, some patients maybe less. So usually when you go for consultation, we will let you know by our experience and the machine that we use, okay? So even for men right now, okay, I do see many men coming in for hair removal right now. Number one is they want to remove the beard. Sometimes it's related to the job. Maybe they're in the industry where they see a lot of customer, so they don't want to shave every single day. So you can see by doing 4 sessions, the amount of hair follicle is very little right now. So even those that remains are basically very small and tiny, so it's easily groomable. Yeah. So yeah, that's all for my sharing today. So thank you for listening.
Thank you, Dr. Steve.
Should I stop? I stop sharing first.
Yeah, you start sharing. Thank you, Dr. Sif, and thanks to those that actually stay with us. Now we are actually open sessions for question and answer. You may drop a question below and we'll get Dr. Sif to reply your questions. Okay, it seems like there's some questions on the live already. Okay, hi Iris. Iris is actually asking, will laser hair removal cause coarse pore? I think large pore.
Oh, okay. So like I said earlier, if we do waxing, I do see a lot of patients have done a few sessions of waxing. The pores become very, very open pores. And also around the pores, there is a dark color, right? Like halo ring effect. So uh, for this case, basically we still treat them with laser, and laser doesn't have this problem because laser will permanently remove the shaft, the hair follicle, everything. It does not cause worsening of a pore problems. So that is why a lot of time laser is better treatment into hair removal.
Okay, good. Okay, Yin Hui, hi Yin Hui. Yin Hui is actually asking, is it good to kill hair follicle?
Sorry.
Is it good to kill hair follicle?
Okay. You know, body hair, right? In medical, there are certain functions for body hair. Of course, it doesn't mean that if you have more body hair, longer body hair, thicker body hair, you got a better body temperature than those without. Because body hair actually have role in body regulation in terms of the temperature. But of course, modern days, we are in a very controlled temperature kind, you know, a little bit cold, we off the aircon, or mostly we are indoor with the air condition. So we control a lot of the temperature of the environment. So I would say that, you know, we don't really have any issues by removing body hair. So a lot of time patient coming in is purely cosmetic reason, okay? Sometimes they have underlying medical condition that have a lot of hair, especially women with a lot of hair, they don't like it. Some of them have hormonal issue like PCOS, which is like polycystic ovarian syndrome. In those patients, they have higher testosterone than usual level. So they will have a bit of the mustache, and then the body hair is very long, so they don't like it. Some patients come to do body hair removal to make their skin look fairer. It does make the skin look fairer because hair, well, it's very fine. It's still dark color, so overall from far, your skin look darker. Yeah.
Okay, since I've talked about PCOS lah, so PCOS patients, right? You
Yeah.
do help them to remove the hair.
Yeah, definitely we help them remove the hair.
But they're still having the hormone issue,
Yes.
and their condition is still coming back. So means that actually they can't like permanently remove the hair at all, right? We will still treat.
So normally what we do is we, as a medical clinic, we do take a full medical history. But there are some PCOS that is probably undiagnosed one, so they don't know. They come in, they just say they have body hair issue, and they don't have other symptoms. You know, they don't have weight gain problem. They don't really have acne problem. They just have more body hair. So when we do treatment, we will still do treatment for them. But for those kind of patients, sometimes it will give us a bit of hint because their hair grow back quicker and they might not get a very good result compared to general populations. So then again, we might give us like a light bulb like that. Or we might need to ask them to get a check. But again, for this kind of group of patients, it is more difficult to treat them, and it's better once we know that they have PCOS, they might need other medical treatment to control the PCOS. But a lot of medical treatment for PCOS also is just to basically control it. So the patient will still living with PCOS. They will be continuously receive the hair removal treatment depending up to the level they think that maybe they are not looking for 80 to 90% clearance. Maybe for them 50% and the hair reduce more than before. We have to manage their expectation. If they're happy, they can do.
Okay. And also from here, because just since patients ask, since public ask about, is it okay to remove hair follicles? So how about remove hair follicles will affect your sweating?
Okay. In a lot of cases, we do see an improvement. But then if you really have hyperhidrosis, like really more than usual excessive sweating, I don't see it helps too much. But we do have other treatment for excessive sweating. So medically, we treat in our clinic with Botox injection. Actually, a lot of people don't know about Botox injection. Whenever we mention Botox, they get very scared, right? They think that of all the plastic face. But actually, Botox is an approved treatment to reduce hyperhidrosis, which is like palm sweating or the armpit sweating. It's very effective. One treatment, and then you can see it doesn't sweat anymore for the next 6 to 8 months, and then they have to get repeated treatment.
Oh, okay. So means that actually this can help those people that has a problem, his issue with the armpit audio problem, right?
Okay. The armpit odor comes along with the sweating. So you sweat more, the smell will come. So I do see, and then a lot of patients who do hair removal, they do tell me there is some improvement. Yeah. But in some cases, it doesn't improve also. So they might need to combine with other things.
Oh, there will be other treatments actually to help for the armpit audio cases lah.
Yes. Usually it's injection related treatment.
Okay, okay. There's another question from Vicky is that how long can laser hair removal last?
Yeah, okay. So to explain a little bit because laser hair removal we deal over 100 of patients over a few years. Some patients coming in with very little hair. Like it depends on the ethnicity. Like in Malaysia, we have different ethnicity, right? So usually I would say Chinese girl come in, they don't have much hair, but they still have a little bit. They still want to get it removed. So different group come in, they might need to get it's not fixed amount of treatment for everybody. So we will get some history from you. Have you shaved before? Have you done treatment before? And then we examine the part, and certain part get better response quicker. You know, there's many factors. But of course, permanent hair removal, right? Basically, it's not 100% kind of result because we hear about permanent hair removal. They're expecting like once I sign up with the course and once I complete the treatment until I'm 90 years old, I have no single hair come out because it doesn't happen like that. In medical, right? Even with the technology that we have today, it's very effective. We can only say 80 to 90%. We can't even say like 99% or 100%. So, but I would tell it is very if because you might have a full blown long hair, dark color hair, and it's very hard to groom it. Every time it will grow very quick. But after your sessions, you will notice that you have a little bit hair coming out, and it's very fine. Majority of the hair no more like permanently doesn't come out anymore, but maybe the 10% will still keep coming out. So maybe after your packages, you might need to do like a touch-up yearly treatments, 1 year, one or twice. So it depends. Patient, once they complete their sessions, don't come back anymore. There's no because they come in with very little hair and their hair is very fine. But if you are the difficult case, then sometimes you have to the expectation we have to tell you might need to come up for touch-up treatment.
Okay, understand. Okay, there's some. Okay, there's. You will also ask another question that is any drawback when our hair follicles are dead?
There's actually not many drawback lah. In fact, like I say, a lot of patients do it for cosmetic reason. They want to have a lighter tone of skin, and secondly is the feeling. If you remove the hair, it will be very smooth, like baby skin, basically. So far, we have done many cases, and patients are very happy. There's no side effect coming out from no hair. Yeah, because some people, like even myself, I naturally don't have a lot of hair. Yeah, it's just like that. There's no problem with having lesser body hair, basically medically.
Okay, there's another question from the thing is there anything she need to do after laser hair removal?
Yeah, it's a very good, very practical question. So for every laser treatment, right, the skin will usually feel a little bit dry. And sometimes patient already have dry skin. So they might have prolonged redness or sometimes dryness that cause they have some itchiness, right? So every time after laser treatment, we in the clinic will apply a layer of moisturizer or aloe vera to cool down the skin. But we will also advise the patient, if you are dry skin type, just get a body lotion and then just apply over the area. It's also help to give soothing effect to the skin. Because it's normal that sometimes if the hair is coarse, example, for the leg, after the treatment, it's a little bit red patches here and there. But it would go away after a few hours. So we have to cool down the skin.
Okay. Okay, there's another question in Hui asks, what are the solutions to help complications of laser hair removal? Is it stop the treatment?
It depends, like I say, on depend on the patient and also what complication that they get lah. So, like I say, a lot of the complication is textbook complication. We don't really see this complication on the day-to-day basis. Like in my clinic, we have hair removal at least 4 to 5 patients a day, and every single day we are doing hair removal. So it's actually very rare that we see any kind of complication. But of course, if the complication do occur, like example, minor burn injury, usually is very minor. It's like first degreeness. Then we will ask them to just apply antibiotic or apply like moisturizer, lotion, that kind of thing over the parts. And then they can continue their treatment. Yeah, so it will be deal individual basis depending on how severe is the thing. So far, I haven't have any touch wood big complication on hair removal because nowadays laser system is so advanced already. So yeah, very safe. We are not talking about 10 years ago kind of laser. Last time, 10 years ago, every time people hear about laser, they think about burn, they think about all the scary things that happen. Nowadays, everyone do laser treatment. It's a daily treatment because everyone start to notice the advantage of, you know, doing laser even on the skin, makes the skin younger, make the pigment go away. It's very safe. But of course, there are certain precautions, your skincare, you know, like body lotion, if you're talking about hair removal that you might need to take care, then we will advise you. It's, after all, still a medical treatment.
Okay. So as we also know, right, like plug or vaccines, they do get armpits darker tone. So will laser hair removal give such a problem?
Okay. Firstly, the answer to your question is no. Laser hair removal doesn't cause darkening. So why does vaccine does cause darkening? In certain people, not all. Okay, a lot of people do vaccine, they're happy with the result. There's no darkening. But usually, if the darker skin type patient, sometimes when they remove the hair on the feet, let's say on the leg, the first few days there will be some inflammation around the hair that is causing some itchiness and all that. So if the redness prolong more than 1 week, it will start to appear hyperpigmented patches. So they get all the dark spot or axillary area. When they remove the armpit hair, then the skin there is basically also pulled off lah, you know, and a certain layer of the dead skin and all that pull off. So then this area is exposed and irritated with the sweat and all that in the armpit. And then start to leave all these dark spot and dark mark. So for laser, it doesn't have this issue because laser spare or laser doesn't affect anything on the skin. It just affect focus on the hair. But of course, patient ask that, can I do laser hair removal? Does it whiten my armpit? This is the normal question that I get in clinic. Unfortunately, laser hair removal machine only deals with laser hair removal. You need to do another laser to remove the pigments, or you can apply some whitening cream. This is another thing that patient asks. If you want 2 things, you need to do 2 treatments. Yeah, basically it's like that.
Oh, okay. All right. Another question from me is that, can laser hair removal target white or gray hair?
Okay. Laser targets color. So if you have white color hair or gray color hair, it's less effective or almost no results because we need the color to be dark color. So if some patient say that, what if I have white hair over my hand and then I dye it color to the black color? can I do laser hair removal now? Actually, you still cannot because we are targeting the bulk, the thing inside the skin to kill it off. So we will not target. So some patient may be very poor candidate for hair removal. They still need to go for waxing and all that. Those people with fairer hair. Some patients have fair skin and fair color hair. Usually not in this part of the country or the world. We are more of a darker hair. But if we get Caucasian patient, it is usually some cases it's very difficult to remove because the hair is not black color.
All right, understand. Okay, usually how does the Dr. Maybe can explain to the public how does one session of laser hair removal take and how many treatment usually require, a cost lah, how many treatment required to achieve the best result?
So this one is very depending on the brand of the laser and what is the engine of the laser. So we have different type, right? Like long pulse, and then we also have a diode laser, alexandrite. So all is basically slightly different from each other. Some you need to shave before you go to the clinic. Some you cannot shave. Some you must leave some hair there. So this one the clinic will basically let you know. So basically, we're back to your question. For each treatment, when patient come in, for my clinic, we use the diode laser. So diode laser require us to fully shave the hair. So we will ask patient either they shave at home or we shave in the clinic. If you want to have a quicker treatment, then you shave at home. So when you come in, we just do the hair removal. But if you want to come to shave and then do the hair removal, sometimes it double up the time. But let's say just a very quick idea, for armpit, it takes around maybe 2 minutes, one side, 1 minute kind of treatment. It's actually very quick if we do hair removal. Yeah, but maybe a bigger area will take longer time. Example, a full body back, usually for men, back hair removal, or the chest, This one take a longer time. Yeah.
Okay, I think today will be this is my last question. How doctor actually get patients advice on prepared before the laser hair removal? Any things that you can get them to take notes?
Okay, I think if you have been doing all these waxing and all the other method of hair removal, I think you can basically try at least one time hair removal laser, and then I think you will be quite amazed with the result, and the comfortability basically is quite comfortable when you're doing the treatment. And I think we are all talking about the safety and also the efficacy of the treatment as well. So if you are surveying around, I would advise you to do one time, get a feel of it, and then before you commit yourself to do like a package in any clinic, and then do your own research. Because right now, day and age, information technology is all internet, and it's your rights as a patient to demand for information. If you want me to eat a medication, I also want to know what medication I'm taking, right? We need to be very well informed about that we do as well. So do your survey and then ask question and do a trial or you commit to something. I think laser hair removal has been quite affordable recently, I think, for the past 5 years. Yeah, so it's not very, very expensive. But you will think about the long term, how much time it saves you from, monthly doing all these things. I think it's quite permanent, so it's quite worth the money lah.
Okay. Okay, thanks, Dr. Steve, for taking your time tonight to do the sharing with us this evening. For friends that are still with us, please do click like to this video and share around if you find this video is useful. And you have more questions actually on the post. You can find a link that connect to Dr. Steve. Okay, don't forget that we also have Erufu page. You can like our others language Erufu page as well. Before and end, I would like to inform that next Wednesday we will have a physiotherapist, Mr. Banlu, to talk about lower back pain. Stay tuned with us. The right clinic, the right doctor, the right care, the right information, the right knowledge. No panic, stay home, mask on. Good night, Dr. Steve. Good night, everyone. Bye-bye.
Good night. Thank you. Bye.
Bye.